Good morning, everyone. Today is Thursday, April 19th, and thank you so much for joining into our weekly healthcare reform webinars. My name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department here at URL, and we run these webinars weekly. I do have to apologize. The last 2 weeks we had to pre-record and the previous week cancel. I did have some scheduling issues, so unfortunately I had to work a different way to get the news out. So hopefully you were able to listen in the recording that came out last Friday. If not, I am going to review some of the items that I did talk about in the pre-recorded webinar last week. So if you have questions from last week, that's a good thing. Just with a show of hands, if you can hear me and see me okay, if you can raise your electronic hand. Excellent, perfect. And that is, of course, one way that you can ask questions. You can either type in your questions in the question box, and I'll answer those at the end of the webinar. You can raise your hand, and I'll unmute you, and you can ask your questions live. So let's just talk a little bit about last week's CMS release. I do think it's pertinent for this audience to, unfortunately review, but just fully understand. So, grandmothering plan extension to 12/31 of 19. It was previously set to expire 12/31 of 18. So the carriers such as Highmark and UPMC that are grandmothering now can extend that even longer. Which obviously for the 2 to 50 market, the grandmothered rates are much better. They're composite rates, it's easier to deal with, and the plans are outside the ACA provisions, so they tend to be a lot less expensive. So this is good news in my opinion for everyone on a grandmothered plan. Just that extension gives everyone a bit of more breathing room until hopefully these rates settle down. Also, the medical loss ratio, this was also part of the CMS release. States are able to lower the insurer's required medical loss ratio if the carrier can prove that by lowering it, that they can create stability. So that should be pretty interesting. Essential health benefit benchmark plans, more choices. So what will that mean for Pennsylvania's plans? Not so sure. I'd say if I were betting that probably not a whole lot of change there that would be significant to affect rates in a positive way or coverage in a positive way. Additionally, there are hardship exemptions for the 2017 tax year. The exemptions cover Americans in counties where ACA policies are not being sold. Americans who say they haven't found coverage because they reside in counties where only one insurer is selling coverage, and Americans who say that only affordable ACA plans cover abortion, and that's in violation of their beliefs. And of course, the last one is Americans who need specialty care that's not offered through affordable ACA plans. So additional hardship exemptions. Also, consumer subsidies for states that haven't expanded Medicaid are going to be more readily available. Pennsylvania has expanded our Medicaid, so that does not affect us one way or the other. But just know this, Pennsylvania Insurance Department has approved those provisions, so grandmothering will stand for another year, and I consider that a huge positive. Some things that maybe we should be a little bit concerned about. Pennsylvania House Bill 504, which would allow unlicensed retail clerks and self-storage companies to sell property insurance. It was determined that limited license producer would have to be issued to the storage unit owner, and then they would designate unlicensed employees as the authorized service reps. They would have to go through pretty stringent testing, as well as have certain provisions that they have to, or disclaimers, I should say, that they would have to inform the client about. So yeah, they have a licensed entity. I don't think this is really outside of anything that, is not necessarily good for us. At least they're forcing the issue that a licensed entity has to be the owner of the unit. So I think that's decent. still a bit of a slippery slope. PA Senate Bill 605, which proposed allowing unlicensed entities to sell travel insurance. And for this segment, they are saying that a limited license would be required and the requirement to maintain contracts with the travel insurance carrier. So that's good for all of us licensed agents. So that portion of any segment of our business is not in jeopardy from unlicensed agents. And let's see what else we have here. Top House Senate Dems warn administration on short-term insurance. The ranking Democrats of 5 House and Senate committees are calling on the Trump administration to withdraw the proposal that would extend the time of, or the time limit on short-term medical plans. They say that if you extend them, that people will have crappy plans and et cetera, et cetera. But from everything that I'm hearing, it's expected to go through, which is, in my opinion, again, a real positive. IRS changes the HSA family contribution. We talked about this before, $6,900 to $6,850. The real issue is that it's being done retroactively. So if anyone has contributed or is on track to contribute, whether it's the employer or employee, the full $6,900, they have to understand that they'll have to adjust that, because anything above that $6,850 would be subject to a 6% excise tax. So I just added that just as a kind of a friendly reminder. New Jersey Health Insurance Preservation Act requires all New Jersey residents to purchase ACA coverage or face a fine at tax time. They say any money collected would go into the New Jersey Health Insurance Premium Security Fund, which would help pay for claims of people who are catastrophically ill. It did pass both chambers. It's essentially mimicking the individual mandate, but the legislation would require the state to seek approval from the federal government to create this reinsurance program. So jury's still out on that, but you know, it's kind of interesting how different states are handling the ACA and the individual tax penalty going away in 2019. Another thing that just came in this morning that I just read this morning, this bill really has no chance of becoming a law, but a group of Democratic senators yesterday introduced an expanded public option for health insurance as the party debates the next steps to build on Obamacare, it says. Essentially, it's expanding on the Medicare for All that was proposed by Senator Sanders, and in this one, it does preserve the private insurance while allowing people in Obamacare plans and employers to choose new Medicare-based insurance plans if they want. So again, not really a chance of it passing, but thought it was worth mentioning. Before we get to the next slide, some upcoming events that could be of interest to you. Next week, we have a webinar on Medicare Offerings Department has a webinar on running Medicare appointments for beginners. So if this is a market that you want to get into and haven't, it'd be an ideal time for you to spend some time on the webinar. And then Health Plan Options Department, our department, is running 2 webinars, May 16th at 2 o'clock, generating new revenue from voluntary benefits, and that's being conducted by Sun Life. And then May 23rd at 2, Highmark is going to be running a webinar talking about the positive changes with Highmark for 3rd and 4th quarter. For those of you in the Western segment, Highmark St. Vincent Hospital terminates relationship with UPMC. That's effective July 1st of this year. And anyone that goes to this facility that has UPMC, it will be considered out of network, and claims will be paid as such. This is not any different from anything that was previously released on the consent decree, but they did put out a blast, so maybe there is confusion in that market. Hopefully this will help. Task is one of our TPAs that handles payroll and administrative services such as FSA, HRAs, FMLA, HRAs, HSAs, all of those things. But we were just told by our rep that Task will meet or beat any competitor's pricing for the FSAs, HSAs, and HRA administration. So if you have such groups that are paying somebody else, an outside vendor, to administer these employer segments, then please reach out to us. We can get a quote. No harm in getting a quote to see if you can save your client some money. Because again, our rep, Rich Durant, said that they will meet or beat any competitor's pricing. UPMC and Select Medical, they expand on their joint venture for physical therapy. This does affect the centers in Cumberland, Lebanon, Lancaster, and York counties. And they're just shifting a dozen outpatient physical therapy centers into this joint venture. So again, as UPMC moves further to Central PA, which they're pretty much here now, you'll see a lot more of these ventures and satellite sort of offices. Starmark. As we know, Starmark has level funded programs, and they also offer a reference-based pricing product. Previously, it was one either reference-based pricing or level funded. Never the two should meet, but now they are saying with as little as 5, they can have some folks take a level funded and some folks take a reference-based pricing product. So that's kind of interesting, and that's a total of 5. New business carrier deadlines. That form is in the newsletter this week that will come out in a few minutes. And it is in Elisa's Corner that we just added that segment. That segment in my newsletter is really just to keep you in touch with any of the carrier changes, anything important that you need to know when submitting business, getting quotes, the day-to-day. So she has some helpful hints in there when she feels they're needed, and the new business carrier deadlines is a great resource for you. So please click on that and download it. And that's it. That's our open discussion. If you have questions, get them going in now. And just while you're formulating those, know that next webinar will be here Thursday, April 26th, and it will be live. And let's see, any questions we have? There are no questions. Jay says good morning, and I say good morning back to you, Jay. And that's about it. So as always, if you think of questions that you don't have right now, let me know. My email, debw@urlinsgroup.com. I'm happy to answer those questions for you. And since there are no additional questions, I say to you that I wish you all a great balance of the week and a wonderful and relaxing weekend. Bye-bye.